We also know that this variant's probably been around longer than Thanksgiving, which was when it first hit the media. In fact, it probably goes back into early November. I wouldn't be surprised if we don't find cases into October. And that by the time everyone freaked out and put in their travel bans, the variant had pretty much expanded around the world, and including to here in the United States. We now have a case in California from somebody who traveled to South Africa. So it kind of goes to show you that international travel bans can maybe slow down spread of a virus, blunt it a little bit, but it's not going to prevent it, and they're probably not necessary. Here are some of the open questions, and then I'll offer my thoughts on each of these. One, is Omicron more transmissible? Yeah, probably. Judging by the rate of increase of infections in South Africa right now, which is almost doubling every day, yeah, it probably is more transmissible. The question still remains, more transmissible than what? More transmissible than the wild type? Yeah, I think so. More transmissible than beta, which is the variant that South Africa has been dealing with over the last few months? Probably. It looks like it is. More transmissible than Delta? I don't know. Maybe, maybe not. So if what's going to happen is over the next few weeks as we watch this, we'll have to see how this battle of supervillains between Omicron and Delta work out. It's almost like a Marvel movie, which for the holidays I guess is appropriate. So if Omicron turns out to have more transmission fitness because of its mutations than Delta, then Omicron will become the dominant variant, and it will become dominant here in the United States at some point. If Delta has more transmission fitness and wins the fight, then it'll still remain the dominant variant. So we'll have to see how all that works out. Right now, we don't really have any information about Omicron versus Delta. Does Omicron cause more severe disease or infection? Early data suggests no, actually, and in fact, the symptoms look like it's about the same. Sore throat, runny nose, fever, aches, and cough, and for most people. The people who are at high risk of severe infection, it seems to be the same as it's been for coronavirus here all along. Those with underlying health problems and those who are older. There actually could be, possibly, maybe, if you're a glass half full person, that it might actually be a little less severe. And that might actually be something that could be welcome, because if Omicron comes around and is more transmissible and affects more people but really isn't all that severe, then people get immune through a cold rather than through hospitalization, serious infection, and possibly death. So we'll have to see, but early data suggests that it's really not any more severe. Do vaccines work against it? Well, we don't know for sure. My prediction is that vaccines will not be totally wiped out by Omicron in effectiveness. And there's actually some data to suggest that my thoughts might be true. For instance, in South Africa right now, while the number of cases of Omicron are increasing and doubling almost every day, the number of hospitalizations are not. And largely, almost all of the people who've been admitted to the hospital with Omicron in South Africa have been unvaccinated. So just like with Delta here in the United States, as we were telling you through September and October, where 95%, 97% of people being admitted to the hospital were unvaccinated people, it looks like that's the same with Omicron in South Africa. That's a little bit encouraging. And suggests that there's at least some protection from vaccine, particularly for severe disease and for hospitalization and death.